Today on Plugged In, the U.S. responds to the coronavirus pandemic. President Donald Trump is himself tested and announces a national emergency. Theme parks closed, sports schedules are suspended, academic years are in limbo. Travel is becoming more difficult. Can social distancing slow down the infection rate? On this edition of Plugged In, the 2020 coronavirus crisis. Hello and welcome to Plugged In. I'm Greta Van Susteren, and we are coming to you from the National Mall in Washington, D.C. Behind me is the U.S. Capitol, where lawmakers continue to work on a national response to the coronavirus crisis. As is customary at any time of national crisis, American presidents speak to the nation from the Oval Office. Here is President Trump speaking to the nation.
This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time. Additionally, last week I signed into law an $8.3 billion funding bill to help CDC and other government agencies fight the virus and support vaccines, treatments, and distribution of medical supplies. Testing capabilities are expanding rapidly day by day. We are moving very quickly. We are all in this together. We must put politics aside, stop the partisanship, and unify together as one nation and one family. As history has proven time and time again, Americans always rise to the challenge and overcome adversity.
Later in the week, during a press conference in the White House Rose Garden, the president was asked about his exposure to the virus. The president has now been tested for the virus, and the White House physician says he has tested negative. Former Vice President and Democratic candidate for President Joe Biden responded with his own plan to deal with the crisis.
Let me be crystal clear. The coronavirus does not have a political affiliation. It will infect Republicans, independents, and Democrats alike, and will not discriminate based on national origin, race, gender, or zip code. It will touch people in positions of power, as well as the most vulnerable in our society. And it will not stop. Banning all travel from Europe or any other part of the world may slow it, but as we've seen, it will not stop it. And travel restrictions based on favoritism and politics rather than risk will be counterproductive. You know, you all do know, the American people have the capacity to meet this moment. We're going to face this with the same spirit that has guided us through previous crises. And we'll come together as a nation. The White House should measure and report each day, each and every day, how many tests have been ordered, how many tests have been completed, and how many have tested positive. By next week, the number of tests should be in the millions, not the thousands. We need to accelerate the development and treatment of a vaccine. Science takes time. And it will still be many months before we have a vaccine that can be proven safe for public use and produced in sufficient quantities to make a difference. But therapeutics can and should come sooner. And when a vaccine is ready to go, It should also be made widely available and, again, free of charge.
Biden and another Democratic presidential candidate, Senator Bernie Sanders, canceled all public events and held a scheduled debate in a television studio without an audience.
Wash your hands with soap and water before you eat, after using the toilet, after touching anything many other people touch, like a seat on a public bus. Scrub thoroughly for 20 seconds. If you cannot wash your hands, use a hand sanitizer. Taking these steps can prevent not only coronavirus, but also colds and flu and other viruses.
The World Health Organization now saying Europe has replaced China as the epicenter of this pandemic. Meanwhile, in London, British Prime Minister Boris Johnson warning many will die. Our European correspondent, Henry Ridgewell, brings us up to date.
Here in Europe, many countries have been put into lockdown in the space of just a few days. The epicenter remains in Italy, where there have been thousands of deaths from the coronavirus in recent days. But there also has been a sharp rise in cases in countries including France, Spain and Ireland, where they have ordered all schools to close, along with all non-essential services like shops and restaurants. And European Union freedom of movement, seen as one of the crowning achievements of the bloc, has also been suspended by many countries who have imposed border checks and health checks on arriving visitors and asking them to self-isolate for as much as 14 days as the virus spreads. So it's clear that many European governments are reluctantly willing to impose a high level of economic damage on their economies in return for trying to control the virus. Now that contrasts somewhat with the situation here in Britain. The streets are a bit quieter, there are fewer people around, but schools are still open, pubs like the one behind me are still open, restaurants are still serving. In many cases, companies are asking their employees to work from home if possible, but we haven't seen the kind of government measures seen in other European countries. And there are two reasons for that. The British government says that imposing controls on movement at the wrong time could backfire because people would not obey them. And secondly, that it is important to build up some kind of immunity within the population so there isn't a second peak of infections later in the winter. All these restrictions are clearly going to have a big economic effect, no less so than in the airline industry. And with America imposing travel restrictions on many European nationalities, those woes for the travel industry are going to continue. And the travel restrictions sent panic throughout financial markets across the world and here in Europe, but also among American tourists who were scrambling to get home. Across Europe, travel plans have been thrown into chaos after President Trump banned most European travellers from entering the United States beginning last Friday. The ban does not apply to US citizens, but many American tourists rushed to get home.
We were not sure if we would be able to get back in, if something was canceled, so I spent $3,000 for another flight.
There was anger among European travellers.
It is a measure that Trump has taken because he is inept, and he has not been able to take any action there, so he is somehow blaming the external enemy, in this case, Europe.
Justifying the ban, President Trump said European states had not taken the same precautions as the US, though EU leaders rejected that claim.
The US decision to impose a travel ban was taken unilaterally and without consultation. The European Union is taking strong action to limit the spread of the virus.
The restrictions apply to all foreign nationals who have visited either the European Union's 26-member passport-free Schengen zone or Britain and Ireland in the 14 days prior to their arrival in the United States. It does not apply to US citizens. The British government, meanwhile, has advised against all non-essential travel to the US.
I must level with the British public. More families, many more families, are going to lose loved ones before their time.
British Junior Health Minister Nadine Dorries tested positive for the virus last week. She came into contact with hundreds of other MPs, including the Prime Minister. An opposition lawmaker also tested positive Monday. The US already has several thousand COVID-19 cases. With the World Health Organization declaring a global pandemic, more drastic measures are needed, says virologist Dr. Stergios Moschos.
My personal opinion is that movement restriction is required across the nations that have hundreds of cases, which includes the United States, it includes the United Kingdom, and it includes many European states.
In Italy, all non-essential services have been ordered to close. The Italian military has put on patriotic displays to lift spirits.
Hospitals there are overwhelmed. They don't even have oxygen anymore to give to people who have dyspnea. So if this doesn't contextualize the severity of the situation and what needs to be done to make sure that hospitals in the rest of the world, where we're running a week to 2 weeks behind of Italy, then I'm not sure what it is. We really need to start slowing the transmission as fast as possible elsewhere.
Many European airlines say they plan to ground up to 90% of their fleet and make large-scale job cuts. With the latest travel restrictions imposed by the United States, the global economic cost is growing by the day. Henry Ridgewell for VOA News, London.
80% of cases are mild. Young and healthy people are at low risk. The elderly and people with serious health conditions are at risk of fatality. If you have a cough, fever, and shortness of breath, contact a doctor and stay a meter away from others.
Social distancing is now the new normal as officials take steps to slow the progress of new infections. Even our plugged-in team is now working remotely. With me is Dr. Susan O'Mara, emergency medicine physician at Washington MedStar Hospital. Usually I interview someone and we're closer. You and I are about how far apart?
We're about 6 feet apart. This is social distancing.
Social distancing, what is that?
So social distancing means staying out of the range where you could be infected if somebody were to cough any kind of infectious particles of COVID-19.
And is 6 feet a pretty good, solid, I can feel safe at 6 feet, or you can feel safe at 6 feet from me?
I feel 100% safe at 6 feet. You're not, when you're distancing yourself from other people socially, you're not just protecting yourself. You're protecting all the people in this country who are the most vulnerable. The older people, the people with diabetes, the people who have heart problems, lung problems. There are a lot of people out there that you're protecting. So the most common symptom with this virus is cough, typically a dry cough. But any respiratory symptoms, including coughing, sneezing, shortness of breath is a key symptom.
How do I know if I have a seasonal allergy or I have the flu or if I have coronavirus?
If we could say that 100% of people who have coronavirus had a fever, for example, that would make this a lot easier. But what we found is that not everybody who has coronavirus has a fever. Some people just have the cough. Some people just have the body aches. And so we've got to be just extra careful. The trick is determining who are those people who we can assure that this is just allergies.
Do you have sufficient test kits at the hospital?
We do.
And what's the test involved?
The test involves, it depends on the lab. The labs that we're using request 2 swabs with basically a long Q-tip. One swab goes deep into your nose, about that far into your nose, and we twirl that around and get a sample that way. The second swab is a typical, like a strep swab for your throat. So we do a throat swab and what they call a nasopharyngeal swab, and we put those into a single vial with a special liquid that preserves viral particles, and we send that to the lab.
Why does it take so long to get results?
Well, right now, the test is not a quick test.
The test itself is, to do the procedure, but to get the results is not fast.
The sampling is quick, but the test itself that on the instruments that they use are not quick, and so those require a lot of time. And the labs are being inundated right now because now we've got testing available.
So if I presented myself at your emergency room and I had respiratory problems and you did a test on me, you would, unless I was in terrible distress, you'd send me home and tell me to quarantine myself, right?
Yes.
And what would you tell me to do while I'm at home?
So while you're at home, to take care of yourself, it's things that are typical of a viral illness, like having the flu. We want you to control your fever because you're going to feel better that way, and for that you'd use ibuprofen or Tylenol. Those also control the body aches. Drink fluids and just rest. You're going to be tired. Go ahead and rest.
It's the same thing I'd do if I had the flu, though, right?
Correct.
So what does it do to have me go to the hospital and find out, okay, you have coronavirus and not the flu, or the flu and not coronavirus?
Right. So what the testing result does for you is, number one, it tells you that whether or not you have to protect your family from yourself. So if you find out that you have a positive for coronavirus, you're going to stay away from family members even when you're at home. You're going to what we call self-quarantine. And that's a lot more extreme with coronavirus than it is for the flu, because coronavirus is a lot easier to give other people. So it'll tell you how to protect yourself from your family members from you. But the other thing it does for you is that it tells you if you develop new symptoms with it, then that's a reason you need to run, don't walk back to the hospital.
Is coronavirus more infectious or more contagious than the flu? Are we finding that?
It is more contagious, significantly more.
People are terrified they're going to die. Can you explain the risk factor on that? I mean, people do die from the flu, but this seems to have a higher fatality rate.
Yes. Well, the fatality rate is developing, because the more testing we get and the more people that we realize in our society have it, then we're going to find out what the real mortality rate is. Initially, the mortality rate, we hope, was a little higher than it really is, because we were really only testing the people who are very sick. Now that we're testing a larger group of people, we'll find out what the real mortality rate is, and we're hoping that's going to be lower than we previously predicted.
Is it coronavirus that will kill you, or is it something like a pneumonia that you get subsequent or with it, or is it?
Right. From what we understand so far, it's the virus itself that can affect not only your lungs but your heart as well. So.
It's shocking, isn't it? This whole thing. I mean, I can't imagine being a doctor and waking up one day and suddenly, you're dealing with this.
Yeah, we're used to having a lot of responsibility for a lot of illness, but this is on a whole new level.
Explain this curve that we're all. I mean, everyone talks about flattening the curve. We all want to flatten the curve. Explain the curve.
So this is where social distancing is super important. The idea of how we want to manage this is we want to make sure that fewer people get it every single day than has happened in other countries. If this came upon us as a surprise and everybody was just roaming around at will, perhaps with coronavirus, infecting people just in a regular day without social distancing, the way that the curve goes is it rises very, very quickly. The number of people around you who get coronavirus will be a large percentage of the people, and a lot of people in this country will be infected very quickly. That's what's going to make it hard to keep up with in terms of intensive care resources. If we stay socially distant from each other and we slow the number of people who get that infection every day, then we'll be able to keep up.
Well, so I guess this is sort of a citizen's responsibility in trying to make it so that you all can do your job. If we overwhelm you with a lot of sickness because we're irresponsible, because we go out and spread it, then you can't even save our lives in essence. I mean, you can't care for us. Whereas if we give you one by one, you can do something if we don't overload you. It's really overload.
Absolutely. When you're distancing yourself from other people socially, you're not just protecting yourself. You're protecting all the people in this country who are the most vulnerable. The older people, the people with diabetes, the people who have heart problems, lung problems. There are a lot of people out there that you're protecting.
I admire every single healthcare worker out there in the front line, because frankly, I like the 6 feet. And if you're a healthcare worker, you don't get the 6 feet when you're caring for someone. You're right there.
Yeah, you are, but you're prepared. We know what we're facing. We know what we're dealing with. And as long as we take precautions from the very first minute that we see somebody, we'll stay safe.
And those masks work?
Yep.
So the healthcare workers can feel confident those masks work?
Yes, and we can feel confident not only from many other viruses and many other illnesses that we've taken care of in history, but also from the data that we're getting from our colleagues in Italy, from our colleagues in China. There's a lot of information coming out of there about what's safe on personal protective equipment, and we're very encouraged.
I also talked to the Surgeon General about a week ago. He told me that they don't recommend that people walk around town with the masks who are healthy, because we keep touching our face when we do, because we don't know how to wear them, and we don't know how to use them.
Yeah, I mean, masks are really to protect other people from getting the particles of the virus, and if you're not spewing particles of the virus, there's really no point in wearing that mask just walking around the city, and you're using a mask that somebody else may really need down the line. And the infectious disease docs who aren't getting these illnesses, a lot of the reasons why we don't get the illnesses is because we obsessively wash our hands in our profession every single day. And I recommend that everybody out there adopt that same procedure. Every time you see some Purell, every time you see some soap and water, wash your hands.
And I suppose that at some point someone's communicating with the CDC and someone with the Surgeon General and the White House. I mean, it's a collaborative effort, but it's also with these other countries.
Absolutely, it's really amazing to watch.
You know, it sort of does bring out the best in all of us, doesn't it?
It absolutely does. And when people ask me if I'm frightened, the reason that I don't feel frightened is because I'm in the system and I know that there are people above me and next to me who are incredibly competent and who are ready to do this, and that's what helps me just move day to day.
So we're going to get through this?
I believe we are. Yeah, I feel ready.
But it's going to be tough till we get there.
It is. It is. It's a challenge for everybody, from the level of the health professionals all the way down to every single person.
Can the virus survive in cold weather? Can the virus be spread by mosquito bites? Is there a vaccine or medication that prevents it? Is there any medicine that cures it? The answer to all of the questions is no. The best steps to take? Wash your hands. Cover your cough. Stay at home if you are sick.
Despite the worldwide pandemic, Japan has announced Tokyo will continue to prepare for the upcoming Olympics. And here in the United States, by declaring a national emergency, the federal government has released up to $50 billion to help deal with this crisis. Fears of a global recession caused by the pandemic has rocked financial markets around the world.
In the United States, there is increasing concern over the economic disruptions caused by the coronavirus, now classified as a pandemic.
We would expect that this is going to potentially be a weak economic period for the United States. We will not see the growth that we had projected.
The travel industry has already been devastated by coronavirus outbreaks on cruise ships and by widespread air travel cancellations. Advisories against public gatherings have prompted the cancellation of conferences, music festivals, and sporting events, and has left restaurants and theaters struggling to survive. Partial closure of factories in China that make automobile parts are raising concerns that American car makers will have to cut production. Financial markets have reacted with fear and extreme volatility, with stock values and oil prices plummeting. President Trump has downplayed the risk the coronavirus poses to Americans' health and their finances.
Well, this was unexpected. It will go away. Just stay calm. It will go away.
The president has floated the idea of temporary tax cuts for affected industries and workers. The White House is also considering paid family leave for workers, but it is unclear how it would be implemented.
Usually in the business world, this is something that business people would become very, very concerned about and typically not like. But I think right now we're facing a public health crisis.
Passing new spending measures will require support from Democrats in Congress who want extra funding for medical testing and care, expanded unemployment insurance, and increased spending on social safety net programs.
It will add to the federal deficit in the short term, but that's important if it means protecting the safety and security of the American public and restoring the economic confidence needed to go forward.
Decisive measures are needed soon, say analysts, to provide immediate relief to those affected and to hasten an economic recovery after the outbreak ends. Brian Padden, VOA News, Washington.
Do alcohol or chlorine kill coronavirus? No. Spraying alcohol or chlorine on your body will not kill any viruses in your body. Both may harm clothes or mucous membranes. Both can be used to disinfect surfaces, but proper recommendations should be followed.
Incheon Airport in South Korea, a major travel hub for East Asia. It usually sees about 3.4 million passengers a week. This is one of the world's busiest airports, and it's a weekday morning, so normally it would be packed. But as you can see, there's almost no one here. This is what airports around the world look like now. Employees with little to do except wait for passengers who aren't coming.
Departure gate number 3.
As governments impose travel restrictions to prevent the spread of the virus. The few nervous passengers who are here do what they can to stay safe.
I prepared hand sanitizer
and I am just trying not to touch anything.
I'm wearing a mask. I took along some hand sanitizer, and I also have some hygiene products like mouthwash.
I was considering canceling my flight, but I really needed to see my brother, so I'm going to go ahead anyway.
Some estimate airlines could lose over $100 billion in revenue this year. Some have already begun cutting flights and laying off employees, while others scramble to reassure passengers it's safe to fly on their planes.
In reality, that's not really going to help. As long as there's travel restrictions, as long as the virus is still spreading and infection rates are growing. Right now, airlines are in survival mode.
Aviation analyst Thomas Kaplan says the industry hasn't been in this much trouble in at least a decade, and maybe longer.
It's global. It's become a pandemic. Traffic is being affected all over the world, not just where the virus started. And now it's starting to remind more of major downturns like post 9/11 time and the global financial crisis.
The big questions are how long the outbreak will last and what governments will do to prop up the industry. But as countries, including the United States, continue to introduce more travel restrictions, the pain is likely to get even more severe. Bill Gallo, VOA News, Seoul.
The crisis has also impacted our plugged-in team. Our 3 interns who came from various parts of the world now making plans to deal with the closing of their campus. We asked them to share with us, in their own words, their experience.
Hi, this is Aishwarya Airy. I'm an intern at VOA's Plugged In, and I'm a graduate student at Northwestern's Middle School of Journalism. With the rising concern around the coronavirus, universities are exercising extreme caution. My university has extended spring break for a week and has also gone completely remote. All our classes right up until April 27th will be conducted online. Other than that, for journalism students, we've also been told that we cannot conduct any in-person interviews. All our interviews will either be conducted on the phone or via email. There are a lot of factors that are also playing on the minds of international students like myself. I come from India and I was seriously considering going back home during the spring break. But with the evolving nature of the travel ban growing to include more and more countries, I'm worried if I do go home for the spring break, will I be able to come back into the US to finish the rest of my program? Other than that, I'm also concerned about being an unknown carrier of the coronavirus, whether it is from the US to my home country or from my home country back to the US. So for now, I'm just following the CDC guideline and exercising as much caution as I can.
I'm an international student and I'm graduating this semester, so while a lot of international students choose to go back to their home country for the rest of the semester, I can't because my visa expires as soon as I graduate. So I will face re-entry issue if I want to come back to US. And the past few days have been very stressful and frustrating, I believe, for everybody. And their student posting memes making fun of getting a degree from online classes, and there are also students petitioning for tuition refund. There are a lot of things going on and a lot of uncertainty. And as a senior, I really don't want my last semester in college to end in this way.
Our school has been kicking people out. They have not been allowing people to stay on campus. You have to go through a rigorous application process in order to stay on campus. And even if you are accepted in that application process, most people will, under their particular circumstance, will have to potentially move from their own rooms. So what a lot of people are choosing to do is they're choosing to take their stuff and just move back home right now.
There is no current evidence that animals can be infected. Hand washing after contact with animals is recommended. This protects against other bacteria such as E. coli and Salmonella that can pass between pets and humans.
That's all the time we have for this edition of Plugged In. We will continue to follow this crisis, and for the latest updates, go to our website, voanews.com. And don't forget to follow me on Twitter, @Greta. We'll see you next week.